More than 300,000 Canadians suffer from epilepsy, and for nearly a third, medications just don't work. But doctors say that there is a treatment and maybe even a cure. The problem is most don't know that it's an option. Joining us this morning with more is Dr. Valiante. He is a neurosurgeon who performed a successful surgery on a young man who had been misdiagnosed for somewhat 20 years. Good morning.
Good morning. How are you?
So why don't more people know about this surgery?
I think it's a bit of a systemic problem. I think we don't have enough information out there. The individuals with epilepsy don't get that information from their practitioners. The practitioners don't quite know that it's an option, and also that it's not really widely known in the media. So, we tend to sort of grow up with an idea about epilepsy that's, it's a futile thing, people will be on medications forever, and it's just a necessary evil.
Well, you're on the media now, so that's good. Tell me about the ideal candidate for this surgery.
So the ideal candidate is an individual which has scarring in a specific part of the brain. And that individual typically has probably had seizures as a child when they had a fever, so febrile seizures. And then they sort of have a period of time where they don't have any seizures, and then as they get older, sort of in the more sort of formative years, like when you're hitting your 1920s, you start to have your seizures. And then they just don't respond to medications. And fortunately, as nature has decided, that the people who are least likely to respond to medications are the best surgical candidates.
What's the overall success rate of the surgery?
So for the kind of surgery that you guys had shown last night, it's about 80%.
80%. Now you're referring to Adam, who was featured in Avis Favreau's piece on the National Anthem, and people can get that online if they like. So, why is it so difficult for some people to receive the proper diagnosis, like in the case of Adam?
Well, I think, we have issues with respect to knowledge. And I mean, knowledge is power. And that knowledge is unfortunately not transmitted to the practitioners. We all grow up with that, idea of that big shaking seizure. That's what epilepsy is. But epilepsy can be very, very subtle. So it's not really put the onus on, bad practice, but it's really to identify the fact that it's a bit of a difficult diagnosis at the best of times.
Dr. Valiante, thank you so much for your time.
My pleasure.
Appreciate this.
The attacks began when Adam Cunningham was just 8 years old.
I was having as many as 10 a day. I felt like somebody was bashing my head in with a baseball bat.
Now 31, he says his life was ruined by the unpredictable seizures. Adam can't live alone. His mother has to drive him around. He couldn't attend the U.S. colleges that courted him as a star hockey and lacrosse player, all because no one could tell him why he was having these terrifying blackouts.
Everyday people said, well, maybe you have epilepsy, but the doctors insisted that it wasn't, because these test results to them were always negative.
They all said there were no abnormalities, and he'd just have to learn to live with it.
But after 22 frustrating years, Adam and his mother finally met a doctor who got it right. Adam had epilepsy.
I was relieved, I guess. Also, I guess, a bit angry that it took that long.
Most people associate epilepsy with grand mal seizures. This is one of Adam's seizures. 80% of epilepsy patients have these more subtle symptoms, often missed by doctors.
If the patient's having these partial seizures, whether or not they lose consciousness or not, that often can take many years to diagnose because it's hard to make that diagnosis. And what's even worse is doctors have to educate themselves more in this disease.
Advocates say there are too few specialists and clinics trained to spot epilepsy quickly, leaving thousands of patients across Canada undiagnosed and untreated.
And I just said
The good news is that Adam is now finally on medications, and while his seizures have diminished, he may undergo brain surgery to hopefully eliminate them for good. 22 long years after they first began. Avis Favreau, CTV News, Toronto. Adam Cunningham has been in a prison caused by seizures that began when he was just 8.
I was having as many as 10 a day. I felt like somebody was bashing my head in with a baseball bat.
Adam couldn't hold a job, he couldn't go out alone. From the outside, the attacks were very subtle. One reason why for 22 years doctors missed the diagnosis. He had epilepsy.
It's a lot harder, even for us who specialize in the disease, to make the diagnosis of epilepsy when they're having these small seizures, these partial seizures, this type of thing.
To his surprise, Adam also discovered there was a chance he could be cured with surgery.
So we're very sure that this is the side from which his seizures are coming from. Given
Doctors at Toronto Western Hospital surgically removed 2 small pieces of Adam's brain.
By removing this, we interrupt the circuits that create the seizures.
There's a 1% chance the operation would leave him paralyzed, but an 80% chance the seizures would be gone with no side effects. Doctors think there are some 20,000 people with epilepsy in Canada who could also benefit from surgery, yet only about 300 get the operation each year.
Where that primarily stems from is a lack of knowledge at every level, at the level of the individual who has epilepsy, and that may be because they're not getting that information, at the level of the practitioners who deal with them, in that they may not be aware that surgery is an option.
And that's why Adam allowed us to film his operation. It worked, and he wants others to know.
My seizures have stopped. I haven't had one, and I feel like I've been reborn, I guess, because this has allowed me to start having a life.
3 months later, he can go out in public without the fear of having a sudden seizure. A life-changing opportunity that began with a proper diagnosis. Avis Favreau, CTV News, Toronto.